Lung cancer is a type of cancer that originates in the lung tissue, resulting from the uncontrolled growth and division of normal cells in that tissue. Normally, cells in our body grow, divide, and die in a specific orderly manner. However, certain factors can disrupt this pattern, leading to uncontrolled cell growth. In lung cancer, this abnormal cell growth and division lead to the formation of tumors in the lungs. These tumors can eventually spread to surrounding tissues and metastasize to other areas of the body. Lung cancer is a complex disease that can arise from the convergence of many factors. The most significant risk factor is smoking. Inhaling harmful chemicals in cigarette smoke can trigger cancer development by causing DNA damage in lung cells. Additionally, passive smoking can also increase the risk of lung cancer. Another significant risk factor is air pollution. Factors such as industrial pollutants, exhaust fumes, and indoor air pollution can increase the risk of lung cancer. Moreover, genetic predisposition can also play a significant role. Individuals with a family history of lung cancer may have a higher risk. Natural radioactive gases like radon can also increase the risk of lung cancer. Finally, exposure to chemicals such as asbestos, arsenic, nickel, and chromium in certain occupations can also increase the risk of lung cancer. When many of these factors come together, the likelihood of developing lung cancer can significantly increase. However, exposure to some of these risk factors does not necessarily mean that an individual will develop lung cancer, but it can increase the risk. Early diagnosis of lung cancer is crucial for its treatability. There are several methods for early diagnosis. Firstly, it is recommended that regular screening be conducted at specified intervals for individuals who smoke or have smoked in the past. These screenings typically include computed tomography, CT scans, which are highly effective in detecting small lesions and nodules in the lungs. Additionally, these screenings, also known as lung cancer screening tests, are recommended preventive health services for certain risk groups. Furthermore, it is important for individuals with symptoms to consult a doctor for early diagnosis, especially if there are symptoms such as persistent cough, shortness of breath, or coughing up blood. Immediate consultation with a healthcare professional is essential. Early diagnosis can prevent the progression of the disease and increase the chances of successful treatment. Therefore, regular screenings for individuals at risk and promptly consulting a healthcare professional about symptoms can save lives.
All right, let's take a look together at what the symptoms of lung cancer are. Cough. Lung cancer typically leads to a chronic or worsening cough. This cough may differ from other coughs, for instance. It can be persistent and accompanied by blood or phlegm. It may be particularly pronounced in the mornings. Shortness of breath. Lung cancer can make breathing difficult. This shortness of breath can occur during physical activity or at rest and may result from tumors in the lungs or blockage of the airways. Chest pain. Chest pain is another symptom of lung cancer. This pain is typically felt in the chest area, but can also occur in the back. The pain often worsens and may increase when breathing, coughing, or taking deep breaths. Grunt. Obstruction of the airways can result in wheezing during breathing. This wheezing can be caused by tumors in the lungs or narrowing of the airways. Spitting blood. Lung cancer is often associated with coughing up blood or bloody sputum. This blood may be visible in the sputum or during coughing. Coughing up blood is typically distinct from other respiratory infections and can be a serious symptom. Weight loss and anorexia. Lung cancer typically causes loss of appetite and weight loss. This can occur due to the body expending energy while fighting cancer. It can also be a side effect of cancer treatment. Fatigue and weakness. Lung cancer can weaken the body and affect the immune system, leading to constant fatigue, weakness, and a general feeling of malaise. Recurrent respiratory infections. Lung cancer can weaken and make the respiratory tract more vulnerable. In this case, the individual may be more susceptible to recurrent respiratory infections. These infections should typically be evaluated along with other symptoms. These symptoms may occur together or individually. However, if any of them or a combination is present, it's important to consult a doctor. These symptoms could be associated with lung cancer or other health issues, so your doctor will conduct necessary tests to provide an accurate diagnosis. The treatment process for this disease works as follows. The treatment of lung cancer is typically determined based on the type and stage of the disease, as well as the overall health condition of the patient. Treatment often involves surgical intervention, chemotherapy, radiation therapy, or a combination of these. Small tumors in early stages are often surgically removed. Chemotherapy and radiation therapy may be used to control the spread of cancer or shrink the tumor. The treatment plan is usually formulated by a multidisciplinary team and may include supportive therapies aimed at improving the patient's quality of life. Throughout the treatment process, patients are regularly monitored by their doctors, and the treatment plan is revised if necessary. Treatment may have side effects that can affect the patient's quality of life, so communication between the patient and doctor is important. Lung cancer can be a life-threatening disease, but it can be prevented and treated with early diagnosis and appropriate treatment. Reduce your risk factors to protect your health, and don't neglect regular health checkups. Remember, health is everything. For more information on this topic, please leave a comment in the section below, and don't forget to subscribe to my channel and hit the like button if you found the video interesting. Until the next video, take care and goodbye.